The HEAL initiative matters because it represents a really serious monetary and resource commitment to tackling a few enormous and intertwined challenges that we face in the United States right now. My project that's funded by the HEAL initiative is attempting to do nowcasting, which means using incomplete surveillance data to predict the present or very near future in terms of overdose. My co-PI, Dr. David Goodman-Meza, and I have a project to build a dashboard that brings in data from the county's medical examiner, first responders, the safety net hospital system, and then syringe services programs, as well as a few other community partners to understand where both fatal and non-fatal overdose happen in Los Angeles. You know, there's a lot of known hotspots, but it's such a vast area that we know there are places that are being underserved, and hopefully by compiling these data and making them publicly available, developing strong partnerships with community stakeholders, together we can make a dent in preventing overdose. It's very much informed by either our own experiences with substance use disorder, whether that's our own or our families. You know, we have a large team where we have a lot of folks involved with lived experience. Now, this project is important beyond Los Angeles for a couple reasons. For one, it's historically been very hard to understand the scope of non-fatal overdose here in the US. There's a lot of reasons for that, but we're trying to tackle it with using that first responder data. The goal being that this will allow treatment providers and harm reduction organizations to know where to go to have the biggest impact, to save the most lives, to meet people who might want to start treatment, and what areas aren't being served. How do we scale up harm reduction to prevent overdose deaths? I define harm reduction as any positive change. It's recognizing that some people will go on a path toward complete abstinence, but many people won't. And people who aren't doing complete abstinence still deserve the chance to be healthier.